Hello, everyone. My name is James Graham. I am a pediatrician by training in the Department of Pediatrics, and I currently serve as the Executive Associate Dean for Academic Affairs in the College of Medicine. And it is a real pleasure today for me to join you to talk about a topic that I've become really passionate about over the years. So I appreciate the invitation to be with you. I know that most of the participants are family medicine attendings or residents, and that you are in teaching settings. And so, teaching is an important part of what happens in our various settings. So appreciate the invitation, and hopefully together we can learn some good things. One of the things that I think we often get misled, or we sort of have this false belief that if we do a good job of teaching, then our students are obviously going to learn. But actually, of course, if you really think about it, teaching doesn't necessarily mean learning. And so if effective learning is our goal, then thinking about and studying the most effective methods of teaching is really important. And I hope today that I can dispel some commonly held myths that we all have. I mean, I went to medical school a long time ago, and medical school was, at least particularly in the first 2 years, but even in the third and fourth year and later, it was largely lecture based. And one of the things I hope to get across today is that there are methods of teaching that are more effective. Now, how ironic is it that I am here suggesting to you that a lecture is not the best in terms of learning, and here I am giving a lecture? Well, we'll get into that, and with the constraints of this platform, it's not quite as interactive as I would hope if we were all in person, but that's not possible because of the distributed nature, and that's fine. But we're still going to try to make this interactive. What I'd like for you to do is to think about what are the key issues. If you're going to teach a group of adult learners, let's say that you've been assigned to do a session next week on community-acquired pneumonia, whatever the topic is. What are the key issues to make your teaching effective for adult learners? And what I'd like for you to do is to put a note in the chat. What do you think is the most important issue that would make your teaching most effective? We'll take a minute, let everybody put that in the chat, and then we'll take a look at what everyone thinks. Alicia, if you can share the answers, that would be great. Here we go. So some of the things that folks have suggested are things like knowing your audience, good voice inflection, attention span. Someone says, another one is make it interesting, but somebody says question-based learning. Well, now we're really getting there. Someone says edutainment. Well, certainly you need to engage your learners, no doubt about that. But I hope that we can carefully think about how to make this most effective. And so I'm going to start with what it has been termed by cognitive psychologists who have really studied the science of learning. And they use this term andragogy as opposed to pedagogy, which is basically teaching methods for adult learners. And these are four concepts that have been described as being particularly important when you're dealing with adult learners. And the first is that the adult learner, the need to know the relevance of the information to the adult learner is important. So timing, for example, is important. If you're giving a session on a topic that the learner sees the relevance of, sees how this is going to apply to their practice, it's gonna be better. So timeliness, adjusting the topic and the depth to the learners is critically important. If you go over their heads or way under their heads, then say, and someone even said in the chat, knowing your audience. That's it. That's what this is about. And then adult learners learn better when they see the application to practice. So, we could have a session and talk, about heart failure, and we could get deep into the pathophysiology and cardiac output equals heart rate times stroke volume, et cetera, et cetera. But adult learners learn that better when they can see the application of practice. And of course, in medicine, that's beautiful for us because case-based learning, you really can go deep into the science in a case-based format, and an adult learner will learn it better. And then lastly, and perhaps most important, is active learner participation. The learner who is passively sitting, listening to a talking head, does not learn. That the data clearly shows, I'll show you some of the data, that the retention of knowledge is not as good as when there is active learner participation and when it's problem oriented. Here's a case, and work through this case, and these basic aspects of physiology or pathology or pharmacology apply, but when taught in a case-based format, it sticks better. So some of what I'm going to describe for you comes from this book, which I recommend. Some of you likely have already have this on your bookshelf and have read it. I actually have it virtually on my Kindle bookshelf. But this book, Make It Stick: The Science of Successful Learning, and this is written by 3 cognitive psychologists who I think really nicely describe a set of concepts from learning science that help make the teaching more effective for the learner. And this shift of thinking about successful learning instead of successful teaching necessarily. And so they say at the beginning of this book, the responsibility of learning rests with the individual. And the techniques for highly effective learning outlined in this book can be used right now, everywhere, learners, teachers, and trainers at work. These techniques don't cost anything, they require no structural reform, and the benefits they promise are both real and long-lasting. So if you want additional information, I'd recommend this book to you, but we're going to go through some of the basic concepts in our session today. Dr. Brown and colleagues in their book have an entire chapter on the common myths that we all believe about learning, right? We've all had far too much, well, not far too much. We've all had a lot of education. And our beliefs certainly are influenced strongly by our experiences. But actually, the cognitive psychology shows that some of the things we believe are not as effective as we might think. So first, mindless repetition by itself is not necessarily effective. So, right, you probably remember, cramming for the final exam, and I'm going to read and reread and reread and reread my notes. Well, it isn't necessarily that repetition is bad, but the timing of the repetition, the quality of the repetition, the type of repetition are very important. We'll talk a little bit about this, what the cognitive psychologists call spaced repetition. And I think it's important in an educational program. So, if you're a program director or a faculty member for a residency program and you're planning out a curriculum for your residents, or maybe you're a chief resident and you're helping with that, you may well want to repeat certain important topics, but when and how you do it makes a difference in terms of long-term learning. Secondly, fluency is not the same thing as a deep understanding. And we really fall into the trap of believing that just because our learner can repeat something, it simply doesn't mean that they really understand it. So, they might be able to say, cardiac output equals heart rate times stroke volume. But what does that mean in this patient who has heart failure? And when we give this drug, how does it really work? Do you really have a deep understanding of how it works? And so don't be misled in thinking that a superficial, that if the learner can simply mimic the superficial stuff, that they really understand it. There is a technique called the Feynman technique. Dr. Feynman was a Nobel Prize winning physicist, I believe, and who became very interested in learning theory. And the Feynman technique is a learning technique that students can use. The idea is that if you're studying some complex topic, then if you can, study it, but if you can explain it in simple terms so that a novice learner could understand it, then you have a good understanding, right? I mean, it's the idea that if you can teach it, then you probably understand it. And that's useful for a student as well. And the Feynman technique is actually something that I teach to our medical students. I recommend they use that as they are studying. Get a whiteboard and explain it. If you can explain the coagulation cascade in a way that a novice could understand it, then you probably have a pretty good understanding of the coagulation cascade. And then lastly, again, this idea of cramming for learners, rereading or mass practice. I mean, how many times we get this this impression that if I'm reading, and I did this as a student, I'm reading the biochemistry textbook, and I've got my highlighter, and I've got my yellow highlighter and my orange highlighter and my green highlighter out, and I'm doing all this highlighting. Well, I'm doing lots of highlighting, but am I really learning? And honestly, it's not as effective. And so this idea of massed practice or cramming is not nearly as effective. And again, if you think in a residency program or in medical student teaching that you're doing, spreading it out, we'll talk about interleaving and changing topics, actually works better. Okay, so in the book Make It Stick, they say that, quote, good learning is active learning. And in fact, in your chat comments, as I said, someone said question-based learning or involving the learners in the process of teaching. And so if good learning is active learning, then what is it and how do we do it? Well, active learning methods are methods which ask students to fully participate by thinking, by discussing, by investigating, by creating. And in an active learning classroom, there's a picture of it here, students are asked to practice skills, solve problems, struggle with complex questions, propose solutions, work through cases, and then to explain the idea in their own words. And honestly, particularly at first, learners can be very uncomfortable with this. And so setting a safe atmosphere is really important. I mean, it's really true about bedside teaching as well, right? I mean, we're the Socratic method, teaching by questioning, but it also has got to be a safe atmosphere. And so research has indicated that these kinds of methods, as opposed to simply a traditional lecture, are especially effective for student learning when compared to simple lecture. So there are a lot of different ways you can do this, a lot of different methods, but the key concepts are learner involvement, making the learner think and discuss and gain a deeper understanding of the topic. I do have a short YouTube video which I'd like to play for you. This is from a professor at Harvard whose name is Eric Mazur, and Eric is a physicist at Harvard, and he popularized a technique called peer instruction. But I just want to share this because he sort of describes his frustration with traditional learning. It is saying on my screen that my screen sharing is paused. I don't know if I resume share. I guess maybe that's what I need to do. Okay. Well, I'm going to stop sharing and reshare so that I can get to what I want to show you. Sorry. All right. Now,
I'm Eric Mazur. I'm a professor of physics and applied physics at Harvard University. I've been teaching physics here since 1984, and when I started teaching, I basically did what my professors had done to me. I lectured to my students. And it took actually quite a while to find out that my award-winning lecturing was not really accomplishing what I wanted to accomplish. My students did not even learn the most basic principles. That's when I realized that education is not just the transfer of information. It's much more than that. And I was focusing simply on that first step, the information transfer, hoping that the sense-making would occur on its own outside of the classroom. So when I realized that my lecturing wasn't that effective, I decided to invert the sequence, which is now called flipping the approach to teaching. I had my students read the book before coming to class, and then in class, I taught by questioning rather than by telling. It was in a sense an accidental discovery. I remember at one point trying to explain to my students something that to me was completely trivial. I took 2 minutes, made some sketches on the board, and then said, turned around to the class and said, and by Newton's third law, these two forces are equal to each other, which was the question that we were discussing. And I could see at once from my students' faces that they were confused. So I asked if they had a question. They were so confused they could not articulate a question. So I raised the board and I tried it a different way. I added equations, and after 8 minutes of what I thought was an absolutely brilliant explanation, the entire blackboard was covered with equations and drawings. I turned around and the students looked even more confused. I didn't know what to do. I knew, however, that half the students had given the right answer on that question on a test that I'd given them earlier. So in a moment of despair, I said to them, why don't you discuss it with each other? And something happened in my class that I'd never seen before. The entire classroom erupted in chaos. They forgot about me in front of the classroom. And what happened was truly remarkable, because in just 2 minutes, they figured out what the correct answer was. I thought for a moment, how can that be? I, the expert, have tried in vain in 2 different ways for 10 minutes to explain it to them, to no avail, and they figured out in just 2 minutes. But now imagine you have 2 students next to each other, John and Mary. Mary has the right answer because she understands it. John does not. On average, Mary is more likely to convince John than the other way around. But that's not the important point. The important point is that Mary is more likely to convince John than Professor Mazur in front of the class. Why? Because she has only recently learned it. She still knows what the difficulties are that a beginning learner has. Whereas Professor Mazur has learned it such a long time ago, he can't even imagine why somebody doesn't understand. He suffers from what my colleague Steven Pinker calls the curse of knowledge. After seeing that interaction, I thought, I have to put that into practice. So as I said before, I asked my students to come to class prepared, having read the book or watched a video of my lecture. And in class now, I teach by questioning. I'll ask a question. I'll give students time to think about it for a few minutes, then commit to an answer, then try to convince each other of their answer, and then I have them vote again, and we wrap up the cycle with an explanation. And basically that cycle repeats until class time is up. And using this approach, which has been implemented across many different disciplines, even outside of the sciences and the humanities, people, including my own group, have shown that it is possible to triple the learning gains because it actively involves the students in the learning process.
Okay, so again, I'm going to stop sharing and reshare so I can go back to the slides. Try to go back to the slides. Sorry about that. Let me minimize this and then no. Sorry. There we are. Okay, so Dr. Mazur has invented this technique of peer instruction, which we'll talk about. But again, the basic idea is teaching by using questions, and this idea of a flipped classroom, which is becoming increasingly popular, but in part because it is effective. So let me start in looking at this idea that active learning is better with this study. There is actually now overwhelming evidence. As I said, I became sort of captivated by this idea a few years ago as I was, sort of responsible for our medical student curriculum and for getting our students across licensure exams and board exams and so forth. And so using the most effective techniques to improve our learners' outcomes just was really important. So this is a meta-analysis that was published in 2014 about the use of active learning in science, engineering, and mathematics. And it primarily dealt with undergraduate college students, but now there is also beginning to be evidence specifically about medical trainees. I'll show you some of that evidence as well. But basically, they showed by looking at all of these studies that, when you compare active learning strategy methods used in a curriculum compared to traditional lecture, students in the traditional lecture curriculum are twice as likely to fail. I mean, it's a dramatic effect. And that mean scores were half a standard deviation higher with lecture. I mean, it really is dramatically better to use these techniques over traditional lecture. Accompanying this article was an editorial written by Carl Wieman. Dr. Wieman is a Nobel Prize winning physicist who, like Feynman, has become very interested in the science of learning. And in his editorial about the study I just showed you, he says, this meta-analysis makes a powerful case that any college or university that's teaching its STEM courses by traditional lecture is providing an inferior education to its students. And he, shows these graphs that come from the meta-analysis where, the failure rates with lecture are double the failure rates with active learning. And, and sometimes people say, well, you're just helping the lowest quartile in the class. No, actually, the high achieving learners achieve better in an active learning setting as well. So the analogy I like to use is that these methods sort of float everybody's boat a little higher. So let me talk about some of the techniques that are important to use in an active learning curriculum or course of study or program. And the first is this idea: to learn, you should retrieve. And so it is, again, what one of you said in the in the chat at the very beginning. It's question-based learning. Just the use of a question and having a learner try to retrieve the answer, that alone helps. Even if they get the answer wrong, then when they hear the explanation, it makes the learning stick better. And so deliberate retrieval improves long-term retention. And the more difficult the retrieval is, the stronger the effect. So the cognitive psychologists call this desirable difficulty. And again, you have to set a safe learning atmosphere. it is mildly uncomfortable for learners at first, but if the goal is we're all here to learn better, then and if particularly if they understand that the reason why I'm giving you these questions, the reason why I'm going to use clickers or audience response in this session, and I'm going to have you, or I'm going to call on people and ask you to explain it. It's not to embarrass you. It's because we're all here together to learn this material. So you can use retrieval practice with clickers, with quizzes, with low stakes, formative assessment. So, residents, as you're preparing for your boards or for your in-service exams, question banks are helpful. They really are helpful. And you should think of it, though, as a learning tool. It's not just a quiz or a set of questions. It really does help you learn the material better and longer. So retrieval practice is a key point and can be used in a lot of different ways in an active learning session. The second concept is interleaving, and as opposed to the mass practice or the cramming. In other words, mix up the topics. So again, if you had a longitudinal residency curriculum and you have certain topics that you want to revisit, mix it up so that, this week we're going to focus on pulmonary complaints and next time on abdominal pain and mixing up the topics. The research, the educational research shows actually, nearly doubles the gains by mixing up the topics. Spaced repetition, and again, this idea that repetition alone is not bad, but doing it over time and being intentional in spacing it out makes a huge difference. So, I mean, this is just a simple study, but they had 3 10-minute lessons, and when you give it 3 lessons over 3 days as opposed to 1 30-minute session, and then you wait 7 days and you give a test, the people who had the spaced practice have much higher long-term retention, or a 7-day retention at least. So being intentional and thinking about what topics do we want to repeat and when are we going to do it, and spacing it out really makes a difference. This technique of think, pair, share, Dr. Mazur in his video talks about how he initially used this, and you really can use this in any kind of a teaching session that you're doing with your residents, with your medical students. And again, the idea is that you ask a question. And if we were all in a room together, which we're not, I would ask you how you could use these strategies in medical education. But on this platform, we can't pair up. But the idea is exactly as Dr. Mazur described. You ask a question, you ask the students, the learners, to think about it, and then to pair up and struggle with what is the answer. And then you ask some of them to share what their answers are, and you have a discussion. And you end up with better understanding than if the expert had just spoken it in the classroom. So I want to give you some ideas of how some of these kinds of techniques can be used in a practical sense in the settings where you are teaching or learning, as the case may be. And so this is a study that was published a few years ago from the University of Kentucky, and they in the anesthesia residency. And so, like most residency programs, they had a lecture series that, every Thursday morning at 7 o'clock, those anesthesiologists and surgeons they start stuff insanely earlier, 6 o'clock in the morning or something, but they had a traditional lecture series. They were 55-minute traditional lectures. And so some of their faculty became interested in some of these concepts. And so they decided that, really we can flip the classroom and we can ask our residents, they made 15-minute videos. So short, instead of a 55-minute lecture, they shortened it, did just the key concepts. And they asked the residents to watch that video before they came to the didactic session. And one nice thing is the resident could watch it when they wanted to. In a busy residency, time is of concern. And so the flipped classroom can provide some flexibility. And then they had in the classroom, they worked through cases with audience response or with think, pair, share. And then they tested knowledge retention 4 months later, and they also looked at learner satisfaction. The residents liked it better because it was interactive. It wasn't just sitting in a lecture after I'd been on call or whatever. And they actually retained the information better. So again, in-service exams or board exams, the likelihood of success is going to be better. So that's an idea that might help in your setting. And here's one from family medicine. And it simply the use of an audience response system or clickers. So in a traditional lecture kind of setting, having questions throughout the lecture and having the audience. So it's a way to engage the learners in the learning. And so they compared and they found that there was both better short-term, sort of immediate recall, but even 1 month later, the learners, the residents, did better on a quiz 1 month later when they compared it to the traditional lecture-only series. So even a clicker system is better than just the traditional lecture. There is a technique called team-based learning, and many medical schools now have incorporated TBL or team-based learning into their curriculum. We certainly use it pretty extensively in the first 3 years. I think the psychiatry clerkship, the pediatrics clerkship, and the OB clerkship now are doing TBLs as a part of that curriculum. So it is a structured active learning process, and where again, it's a flipped classroom. The learners watch a recorded lecture or read an article or read part of a textbook before they come to the didactic session with the faculty expert. And then again, it's a question-based approach where the learners answer a little quiz and then they have a discussion among themselves. They take the quiz again. And so this is a study where they used this method in internal medicine ambulatory resident teaching. So in their internal medicine outpatient clinic rotations, they had these, instead of having lectures associated with their clinic sessions, they did them using this TBL technique. And we don't have time for me to go into all of the details about TBL, but I'm going to show you some resources. If you are interested in learning more about TBL specifically, you could ask our medical students. They're very familiar with how a TBL works, but I'll also show you some resources about it. And then Dr. Mazur's peer instruction. And as he described, it really came out of this idea of think, pair, share, but in Dr. Mazur's classroom, and now when we use peer instruction, our students, for example, are given a pre-class assignment. So it's a flipped classroom. Here, study this set of materials before you come. And then the entire session is a set of questions and discussion with peers about it. This is a study that Dr. Mazur and a colleague at, I think it was a Brazilian medical school, 225 students in a Brazilian medical school. But basically they showed 15% increase in knowledge retention using peer instruction rather than lecture. So again, peer instruction is a technique that might fit in some settings. So here's some resources. I've already mentioned the book, Make It Stick, The Science of Successful Learning. It's an easy read and really pretty interesting. And then the book, Powerful Teaching by Dr. Agarwal. Dr. Agarwal actually was a graduate student under, I think, Dr. Rodinger. And so she has sort of taken that work even further. So both of these books, if you have interest in these kinds of topics, they're great resources. There is a website called retrievalpractice.org. Dr. Agarwal and a group put this together, but this website has a whole bunch of ideas on how you can use particularly retrieval practice, question-based teaching. And there are guides you can download and a lot of different resources. So retrievalpractice.org is a place where you can get some good ideas on how to use at least retrieval practice in your setting. As far as team-based learning, this book, Team-Based Learning for Health Professions Education by Michelson and Parmalee and colleagues, I think it's about a 100-page book. It's an easy read. They describe the entire process of how you can use small groups and use this technique to improve learning. And so that's a great resource. There's also a team-based learning collaborative. And I think if you were to just Google TBL Collaborative, they have a nice website with resources as well. For peer instruction, Dr. Mazur has published a textbook, but there are also lots of YouTube videos about peer instruction, or if you just were to Google Eric Mazur, M-A-Z-U-R, I showed you that little 5-minute clip, but he has even some 1-hour lectures on YouTube where he goes through in much more detail how to do this. So again, it has been a real pleasure to have the opportunity to connect with all of you, even though it is through this virtual means. As I said, this has become something that I've become quite passionate about, because I have seen the effects of it. For example, our step 1 pass rate in the College of Medicine here. Previously, before we changed the curriculum in 2014, we were having pass rates, in the mid-80s, first time pass rates. And we changed it was about an 85 or 90% lecture curriculum. It's sort of like when I went to medical school, and maybe some of y'all, depending on how old you are, but we changed the curriculum, and now only about half of our contact hours are traditional lecture. If it were just up to me, and it's not, but if it were, we would do like a few medical schools in the country have done, and we would get rid of lectures completely. And maybe someday we can. But we have seen significant increases in our board pass rate. Immediately pre-pandemic, we had gotten to the national average when we had achieved a 95% pass rate. I will be happy to take any questions that you have. I'll leave you with this quote from Albert Einstein about the importance of understanding. And I think when we have a role as a teacher, we should think more about how effective is the learning for our students than for exactly, how well am I lecturing or teaching. So again, thank you very much. And I will see, there's some questions in the chat. So the first question I see is, without sending a ton of resources, how can we quickly and efficiently encourage instructors and guest speakers to create more interactive lessons and teaching? Well, again, it's as I said at the beginning, out of the beginning of the Make It Stick book, these techniques don't cost money. If you don't have to use fancy technology. I mean, so if you have a lecture that, you know, I give this lecture 4 times a year to different groups that are rotating through my clinic. Well, at the very least, incorporating questions and having some discussion with your learners is going to work better than if it's just the entire hour with the faculty member teaching. So you really don't have to have a ton of resources or other things at the very least. But if you can get to a place where you can do a flipped classroom, where you have your learners study something, whether it's a recorded lecture or an article or a textbook or something that they prepare before they come, and then in the didactic session, if you can then make it case-based or problem-based, and have the students really engage with the content in a case, then it's clearly going to be more effective. And I'll tell you, as a faculty member, I find it a lot more fun. It's a lot more fun to engage with the students and to discuss cases than for me to just, okay, let's go through the pathophysiology of heart failure. I find it just a much more satisfying process as a faculty member. All right. Alicia, having said that, how do you get other instructors on board? We all know just lecturing is easier, less creative and less effort. Yeah, that's one of the issues, right? We all, as I said, we've all had a lot of schooling, and most schooling still to this day is traditional lecture. And honestly, at least at first, traditional lecturing is easier, particularly if you are giving the same lecture to different groups over time. You just pull out your old slides, dust them off, and go give your lecture. And it does take some time, some thought to create case-based discussions, that sort of thing. Although, you know, once you've created them, then that extra work is done. And so, for example, in our Molecules to Cells course for first-year medical students, Alan Diekman, the course director and a member of our biochemistry faculty, I mean, I think he gives 11 TBLs in that course. And I mean, he tweaks them every year, but again, it's kind of the same thing. He takes it out, he dusts it off, he tweaks it. And so that helps sort of getting folks on board. And then there is real resistance among faculty. I mean, it's at first, sometimes it's hard for people to believe that giving a student a flipped classroom assignment and then coming and just asking them 10 different questions in an hour over that topic is going to be as effective as if I go through a very detailed discussion as the content expert. But the data from these studies shows dramatic differences. It really is more effective. And I think as in our role as teachers, whether we are medical school faculty, whether we're residents who are teaching medical students, whenever we are in the role of a teacher, having the mindset of what is most effective for the student to learn is it's the key thing. It's not that I get a high teaching evaluation. Y'all are going to evaluate my session today, and I will read it and I will take it seriously. But really, what's the key point? The key point is, have I been able to convince you that these techniques work better and that you might want to try some of these things and use them in your teaching? And if I've been able to do that, then I've been effective. Do you have strategies on how to use these? Do you have suggestions on how to use these strategies one-on-one? For example, supervisory role for employees. Well, I'm not sure about how it would necessarily apply to employee supervision per se, but certainly if you have a one-on-one kind of teaching need. So, for example, maybe you have the need to teach, a new nurse or a new employee comes to work in the clinic, and you need to ensure that they, I don't know, understand HIPAA or understand bloodborne pathogens or whatever. Then I think a flipped classroom thing can really work well. Here, watch this video, and then either have a discussion with them with questions or answer questions. So it certainly can work one-on-one or even in small groups. Using retrieval practice, question-based learning is I think really quite effective one-on-one or in small groups. How do you think these methods may be utilized in a virtual setting? Sometimes remote learning is necessary. And Dr. Mazur made it a way of reaching many educators through virtual means. Yeah, that's absolutely right. And I think going forward, we're going to have more and more virtual education or hybrid education, where we have maybe a group of learners here in this classroom and a group of learners in a classroom in Fayetteville, or a group of learners in a classroom in Fort Smith, and we're going to connect them all together. And I will admit, I will say that it is, at least at first, a little more challenging in the virtual setting. But honestly, we've had first and second year students in Fayetteville now for the past 2 years. And so we use these active learning techniques, team-based learning, peer instruction. We have again, you have to have some technological resources to help facilitate being able to do it in multiple settings, because, if you're going to have discussions and you're going to call on learners, you got to be able to call on the learners in Fort Smith or the learners in Fayetteville or the learners in Little Rock. So you have to think through how can we do these things in a virtual setting. But I think it absolutely can be done. And I think in the virtual, one of the things we learned in the pandemic, I think, is that, learning gains, if you look K through 12, you look at college, and it's been true in medical school, the pandemic and the shift to virtual did have I believe, a detrimental effect. The national pass rate on step 1 went down, I think, for the first time ever this past year, and it is, at least in part, pandemic related. So I think you have to be intentional. I think you have to think through making the technology work, but I think it is absolutely possible to use these techniques in a virtual setting. As I said, like the flipped classroom, you can certainly record really good teaching lectures and then follow it with case-based discussions, even in a virtual setting. Has anyone created topic-guided scenarios which require participant engagement? Escape rooms have become popular. What if we had a patient room? Students had to solve the case and save the patient. Just thinking through ideas to make it work. I think that's fantastic. I mean, I think that's just fantastic. It uses these kinds of concepts to actively engage the learner in a fun and interesting way. And I'll bet you that if you, instead of an escape room, you did a patient room and you had a group go in and had to solve the mystery, I think it would be likely to be very effective. I think the learners would love it. And that is exactly the kind of thinking that I hope maybe I have been able to provoke for you. I would be excited about that. All right. Well, Alicia says that we are finished with questions. Again, sincere thanks to the Department of Family and Community Medicine for the invitation to spend this time with you. I hope that what I've been able to share has stimulated some interesting thoughts for you, and I wish you the very best as you go forward in all of your teaching and educational efforts. Thanks a bunch.